Dr. Mary Larson will be presenting on the effectiveness of evidence-based practices being taught in an online format. Dr. Larson is an associate professor in the Department of Public Health at NDSU. She has 32 years of experience in public health in a variety of settings, including higher education, community health, and outpatient clinical practice. Her research interests include policy, systems, and environmental approaches to lifestyle medicine integration into primary care, health equity, motivational interviewing, empathy, and burnout of public health, healthcare, and human service professionals. Dr. Larson is a member of the Motivational Interviewing Network of Trainers.
Good afternoon. Thank you for that introduction. And we're going to start off this public health seminar series talk with a couple of sort of guidelines or things to be thinking about with an online presentation. So first things first, we have been inundated with Zoom, and it's real important that we start off with this sense of being present. I'm going to go ahead and get Kylie admitted. Okay. This sense of being present. And so with that, I'd like for you to remove any distractions that you might have right now. You might silence your phone or put it away. You might step away quickly and get yourself a beverage. You might pull out some note-taking items so you can take some notes, and then just center yourself. So a couple of deep breaths and get prepared to spend a little bit of time with me on this Zoom presentation. A couple more notes that I'd like to cover about Zoom, the platform that we're using. All of us, I think, who are on the call right now are really well versed in Zoom. There's the mute and the video buttons. So you could click on mute and click start your video to say hello right now.
Hello, I'm Maurette, the librarian.
Hi, Maurette. Good to see you.
Hello,
Hi,
Mary,
Divya.
you know me, I'm Divya.
I do. Hello, good to see you. The other thing that I want to draw your attention to is on your Zoom screen, you will see a chat box where you can chat out comments or questions. You will also see a reactions tab on your toolbar. And under your reactions tab, you'll find a check box or a check mark, a green check mark that indicates yes, and a red X that indicates no. Would you go ahead and use the check mark and the red X? Let me just see those come up on your screen here real quickly, because we're going to use those in just a minute. All right, thank you. I see the yeses. All right, and then to get rid of that, you either click on it again or you click on a different button. All right. Excellent, thank you for that. And lastly, the other thing that we'll be using today is this annotate feature. And so if you've ever, how many of you have used annotate before? Click your yes box if you've used it and your no X if you have not. Okay. All right, so looks like several of you have used it before. Divya, are you able to find your stamps, or not your stamps, but your yes and your no? Okay, Divya has not used it. All right. Okay, the other thing that we're going to be using is under annotate. If you click on this annotate box, there will be the stamp box. And that stamp, we're going to be using the stamps here in just a couple of seconds as we move on. All right. Okay. So with COVID-19, things have really shifted. And what I'm wondering about is prior to COVID-19, what was the primary way that you engaged in either academic learning or, for those of you who are working, your work? So what I'd like you to do is take a stamp and place it on this continuum. So again, how have you engaged in either academic learning or work prior to COVID-19? So far we've got one stamp. And if you're unable to annotate, you might just chat out. Where you would place your stamp if you were able to put it on the continuum. Okay, so for Divya, I'm going to go ahead and place your stamp on in person, because that's what you said. And for, let's see here, Andrea, okay, Kylie's mostly in person with many meetings online. Okay, so prior to COVID-19, you would probably be somewhere in the middle then, Kylie. And yeah, all should be able to annotate. You just have to toggle your, I'm trying to think of where your annotate would be. For me, it's up at the top of my screen when I'm sharing my PowerPoint. So I'm going to place another check in kind of this area here for Kylie, because she said a lot of things were in person, but also there were some things that were online with many of the meetings. Okay, so this is prior to COVID. Now, if we had 100 people in this session, we would see a lot of check marks that would probably be shifted over to this in-person experience. So now let's take a look with our next question is, how are you currently engaging in learning or meetings or work experiences? Indicate what's most common for you right now. And we'll go ahead and erase the ones that are here. Okay, so go ahead and indicate where you would be now. Okay, a lot of synchronous online, some asynchronous online. So Kylie, you're, okay, I see you're moving it over. Okay, so a lot of synchronous online is what we're seeing now currently, okay? Just like this is right now. We're synchronous and we're online, okay? We're not in person. All right, let's go to the next one. I'm gonna erase these. Now I'm asking about your preference. What is your preference? So prior to COVID-19 and the pandemic, how did you prefer to learn or work? In person, synchronous online as we are now, or asynchronous online? Go ahead and put your stamp. Okay, so again, we're mostly going to be in person with some synchronous online kinds of things. That's our preference. Now with COVID, since COVID, how would you prefer to learn or work since COVID? Where would you put yourself? What's your preference if you had to choose? Okay. And we're getting, you know, some in-person preference. So prior to COVID, our experience was more in person, some synchronous, and that is largely our preference. With one person who would be perfectly happy with asynchronous online if we could arrange that, right? Okay, excellent. Thank you for sharing how you feel about that. And I'm going to erase these. I think those stamps fun, just fun. So I'd like to talk about a little bit about workforce development and training, and just to set the stage for the research project that I'll be talking about in the seminar today. So our COVID-19, the pandemic really exposed a lot of areas of education, K through 12, higher education, and professional development, continuing education for any number of professions. So the pandemic exposed and sort of launched us into the need to use methods other than face-to-face for teaching and learning. And there's also that same need for training healthcare clinicians, public health practitioners, and human service professionals, because their need for evidence-based practices is ongoing. This is particularly true in terms of access to training and evidence-based practice skill development for those who are in resource-poor areas, resource-poor countries, or geographically isolated areas. They have a particular need for accessible and efficacious training. And that may or may not be face-to-face because of the geographic and the resource limitations. So the most common training methods currently for health, public health, and human service professionals include in-person workshops, synchronous and asynchronous webinars, and self-study. And each of these methods comes with their own set of advantages and disadvantages. So part of my research question was, can we effectively use online platforms to train health and human service professionals in motivational interviewing? How many of you have heard of or used motivational interviewing? And let's go ahead and start with a new checkbox or check mark for yes, or a red X for no. So, all right, we've got some yeses, okay. Excellent. And Andrea, I don't know, your yes check mark, it just was kind of static. That might mean that you're always yes, right?
I can't stop annotating. So I'm just going to try to fix this.
All right, that's okay. So most of you have heard of motivational interviewing. And who knows what motivational interviewing is? Like, how would you describe it to someone? And you can go ahead and unmute yourself. What have you heard about motivational interviewing? Maybe that's a little bit easier question to step out into that uncertainty.
Well, Mary, I could answer, but I feel like it's unfair because I've gone through the training. Do you want me to answer?
Absolutely.
Okay. So I've used motivational interviewing when I was a personal trainer mostly. And it's developed to help people maybe with more challenging problems work through them in a way that they can feel like they're making the choices and being really autonomous and part of the solution. So it cuts down on defensive mechanisms and as a conversational approach. That's how I would describe it.
Excellent. Thank you, Steph. Thank you. So Steph did a really nice job of summarizing what motivational interviewing is. The definition, one of the definitions is that it's a collaborative, person-centered form of guiding that elicits and strengthens a person's motivation to change. And so there's several, I mean, we could unpack this, but just suffice it to say is that it's a clinical and public health tool or skill that we use with people to help them be successful in their behavior change. Motivational interviewing, the use of MI has been shown to improve behavior change, treatment retention, and program outcomes. It also, MI helps to develop a working alliance really quickly with another person, and with expressing accurate empathy and also individualizing the approach to that person. MI is an evidence-based practice. There are hundreds of clinical trials and research pubs that show motivational interviewing to be helpful in situations where behavior change is needed or desired. People of color actually represent 40% of the clients who are participating in the clinical trials. So it has a very good transference to people from other ethnic and racial groups. In addition, motivational interviewing has been translated into over 41 different languages. So motivational interviewing is an evidence-based practice that is used worldwide. It's also used in a number of fields. What's interesting about MI is that we started using it in chemical abuse work. And so motivational interviewing really got its traction, if you will, in alcohol addiction work. So very intractable types of problems where it's really difficult to help a person make a change, because it's not only a behavior, it's an addiction. And now motivational interviewing is applied in many different areas, like Steph mentioned, with personal training and health coaching, in primary health care, mental health, and public health. For example, vaccine hesitancy, and I know Kylie's on the call. In corrections, so with probation officers, motivational interviewing has really taken off across the United States, but also in other countries. In education, social work, and even in dentistry. Motivational interviewing is typically trained. People participate in training, and it's typically delivered in in-person workshop formats. Typically, there's one trainer for every 15 participants, and there's a various kind of amounts of time depending on the goals of the participant in terms of the length of training. A lot on this slide, but this gives 6 different types of training that is available in motivational interviewing, and there's probably other nuances that we could add to this. In Introduction to Motivational Interviewing, this very first level, we could spend anywhere from 2 hours to a day in, helping a person understand an intro to motivational interviewing. Application of motivational interviewing, so to learn one or more specific kind of components of MI, we might spend 1 hour to 1 day. If we're training someone to use motivational interviewing clinically or professionally, so this could say clinical or professional training, then we're going to be spending 2 to 3 full days in training. There's advanced clinical training, another 2 to 3 days, and basically it kind of builds as well. So advanced clinical training for 2 to 3 days wouldn't be without first having some introduction, doing some skill development, participating in some clinical training. Then we're participating in more training to get more advanced. There's also supervisor training if you're a supervisor of others who are using motivational interviewing in your work. And then there's the train the trainers, and that's where the person has probably gone through a number of different trainings and coaching and feedback and tapes and all of that, and then they submit their work to become a trainer, and that's a 3 to 4 day experience. And I am going to erase a couple other little X's here. Okay. So again, I'm going to touch base on the research question that we had. And basically, we were wondering, because there's a lot of trainers, either trainers who are qualified to train or people who have some exposure and experience with MI and feel that they are able to provide some training. There's a lot of people who are training in motivational interviewing, and they're doing it in different ways. There's some online synchronous, there's some online asynchronous, and then there's, of course, workshops and in-person and face-to-face. And what we started asking is, well, is there a difference in MI skill level between individuals who are trained in a face-to-face workshop compared to individuals who are trained in an online synchronous format? That was our primary question. And we wanted to answer the question, can we effectively use online platforms to train health and human service professionals in motivational interviewing? So we set out to conduct the study. We recruited participants. We sent emails to supervisors and also word of mouth through several different agencies on mostly on the Minnesota side. So Clay County Public Health, Minnesota Partnership for Health Programs, and the Minnesota Department of Health. We had 69 individuals register to participate in the motivational interviewing training and study. And our trainer wanted to limit the size of the online synchronous and the face-to-face groups to 20, because any one trainer, there's sort of a threshold of comfort of the trainer and effectiveness of the training with a certain number of participants per one trainer. So we randomized 20 people into an online synchronous group and the other 20 into a face-to-face workshop format. Of the 20 individuals who were randomized into each of these groups, of the ones randomized into the online group, 15 of them completed the initial survey. And then we ended up with 6 individuals who completed the majority of the training sessions, the surveys, and the audio recording at the end of the training. The face-to-face group of the 20 who were randomized, 18 completed the initial survey and 11 individuals completed the 2-day training, the surveys, and the audio recording. We had 29 individuals who were randomized into waitlists. And so as people dropped from each of these different groups, we populated them back in to try to get up to 20 people in each of these 2 groups. The research design that we used was that we randomized participants into one of 2 groups. The training was either face-to-face or online synchronous, but it was the same training and the same trainer. And then we measured the outcomes, which was the audio tape and measuring skills of the person using motivational interviewing with another person. Again, the randomization into the 2 groups, the training was provided by the same trainer. So we were trying to control the variables that we could. Randomization offers an equivalency of each of the groups. So that was another piece that strengthened the design and reduced the selection bias. The face-to-face training was offered on 2 consecutive days and totaled 14 hours of interactive training. The location was over at the Clay County Family Service Center, and the schedule was 8:30 to 4:30 with a lunch break. The online synchronous training, we used the Cisco WebEx platform. It consisted of 6 sessions, a total of 14 hours over the course of 2 weeks. The location was, of course, determined by the participant, and each individual needed to have a computer and excellent internet connection. And the schedule was, the first session was a 1 to 4. That was a 3-hour session. And then sessions 2 to 5 were 1 to 3 p.m. And then session 6 was 1 to 4 again, another 3-hour session. The training components for MI included the spirit, which is the foundation for motivational interviewing. And so there was a certain amount of time that was dedicated to talking about and working with, through active strategies, the participants to learn this about the spirit. The spirit consists of partnership, evocation, acceptance, and compassion. And acceptance kind of it's a big area of spirit, and we can unpack that even further. And that includes honoring one's autonomy, absolute worth, accurate empathy, and affirmation. So spirit is kind of the heartbeat of motivational interviewing. It is again, the foundation. Without spirit, you can use all of the micro skills, which are in the circle bubbles above spirit: open questions, affirmations, reflections, and summarizations. But if one uses those micro skills without the spirit, it's not MI. So this was an important component of the training. Other training components included the 4 processes, and that's engage, focus, evoke, and plan. And so there's skill development within each of those processes that the training would focus on and include. So the participants who ended up completing the audio recordings, as I said, we had 11 in the face-to-face group and 6 in the online group. They were fairly similar in terms of demographics, their mean ages, their education levels, their professions, and their years of work in health and human services were all fairly similar. The other thing we looked at was the participant experience in motivational interviewing, and the face-to-face group, and again, the online group, quite similar. In fact, I would say that there was really just one person in each of the groups who had, really quite a bit of training under their belt, but otherwise most everyone in the 2 different groups were relatively new or had no training in motivational interviewing. We measured proficiency of motivational interviewing, and instead of asking someone to self-rate, like their knowledge, their skill, their confidence, we used an objective measure of proficiency. And how we did that was we used this instrument called the Motivational Interviewing Treatment Integrity. There are several versions of it. The version at the time that was the newest and updated version was 4.2.1. It's called the Mighty. The Mighty is it's used in clinical trials to measure treatment integrity. It is a means of providing structured and formal feedback about ways to improve one's practice. So it's used with coaching. And it's a component of selection criteria for training and hiring. So different agencies and organizations who are looking for someone to have motivational interviewing skills, that person could submit an audio tape and that would be coded before they're hired. They want to see that that person has competency and proficiency. It's also used in order to become a trainer in motivational interviewing. So the training of new trainers through the Motivational Interviewing Network of Trainers requires tape submission, and that's coded before a person gets accepted into the training program. So in terms of the Mighty coding, we used 2 trained coders, not the person who did the training and not the researcher. So there were 2 trained coders. The audio tapes were randomly assigned to one of the 2 coders, and the coders were blinded from the method of instruction. So the coders didn't know if this was an online participant or a face-to-face participant. The mighty coding and the coders, they evaluate the use of the 4 processes, and they also assess the 4 global dimensions, which include cultivating change talk, softening sustained talk, partnership, and empathy. And they assess behavioral counts. So what do I mean by all of that? So the global ratings scores, there's, as I just mentioned, the partnership and empathy, that's called the relational global score. And the other 2, the cultivating change talk and softening sustained talk, are considered technical global scores. The mighty scores are, it's a scale of a 1 to 5. A 1 is low, a 5 is excellent proficiency. And there's a threshold for beginning proficiency, and that is 3.5 for relational, and then 3 for each of these components, 3 for technical, and then 3 for each of these components. And so 3, kind of that neutral area, but it's not neutral. It's in the mighty scores. It just means that that is the standard that is considered beginning proficiency. So the difference, well, basically, we didn't find any statistically significant differences in this between the 2 groups. So our face-to-face group and our online group, the only kind of blips that we really saw were with partnership with the face-to-face group and empathy with the online group, which was kind of interesting, being that you're not sitting with the person, but you're still able to express empathy. So again, there were no statistical significant differences. And for the most part, the 2 groups looked very similar to each other in terms of the global rating scores. When we look at the behavioral counts, there's a mean again for the face-to-face and a mean for the online groups. And we saw one statistically significant result, which was in giving information, and that occurred more often in the online group. So basically, giving information is where the practitioner will provide just expert information or guiding, not guiding, but just expert information. So it would be like, oh, well, have you heard of Weight Watchers? You know, as an example, for a person who wants to lose weight. And so they would just insert expert information and give that to the person. That happened more often with the online group than it did with the face-to-face group. Otherwise, again, we're seeing that we didn't have anything statistically significant. You know, if you want to use the language of maybe approaching significance, maybe with seeking collaboration, but, you know, just really very similar skills and behavioral counts between the 2 groups. The 3 items that are in the box, affirming, seeking collaboration, and emphasizing autonomy, these are very special behaviors that we're pretty careful when we're coding to be fairly judicious about coding these. And that is because they're called MI adherent, and they increase in their level of complexity and their level of worth. So emphasizing autonomy is one of the hardest things to do in motivational interviewing, but also one of the things that counts the most. And we did see that happen a little bit, not very much, in the face-to-face group. And we also saw seeking collaboration in that face-to-face group. We heard it rather on the audio tapes. And then with affirming, we heard more affirmations with the online group and more of that affirming way of being. So to continue on with some of the mighty scores, again, our p-values indicate that we don't have anything statistically significant at the 0.05 level. We have something that, again, if you wanted to use that, approaching significance with the MI adherent. That would be mainly the online group from the affirmation count. The other kinds of things that we're looking at is we're looking at how many complex reflections are being provided, the percent of complex reflections. Proficiency threshold is 40%. We want to see at least 40% complex. We must have worked on this a lot. The trainer must have, because this is really high to have this many complex reflections, 65 and 77%, especially with a group of participants who largely did not have a lot of experience. The other thing we're measuring is the ratio of reflections to questions. A 1-to-1 ratio is really that proficiency threshold. We're looking for a 2-to-1 or greater for people who are higher level competency. And here we had that 2.4-to-1, and with the online group, a 1.3-to-1. So that's a little bit more about those mighty scores and how we were measuring objectively the differences between the two groups. Another thing we looked at was the preference of face-to-face or online training. And we looked at that at 3 different points. So we looked at initial, what do people prefer? So this is the face-to-face, the group that was randomized into face-to-face. This is the online group, randomized into online. Initially, the preference for online was a little bit higher in those who were randomized to online. And the preference for face-to-face was higher for the online group, even though, they were going to take an online course. They preferred face-to-face. And the face-to-face participants also had a stronger preference for face-to-face than they did online. Right following the training, we again measured what the preference was, and participants could say they had 2 questions. To what degree do you prefer online training, and to what degree do you prefer face-to-face training? So they didn't have to pick, they could just say what their preference was. In this particular time frame, it's interesting that the online group, their preference in online popped up. They had a good experience and it wasn't so bad. But the face-to-face group, again, did not prefer online. In fact, that dropped down a little bit for them, not even having had the experience, but their face-to-face preference really popped up for them. They're convinced that's the way to go. And our online group, their preference for face-to-face is about equal to their preference for online. Then we measured preference again 3 months later, because part of training is sort of managing expectations and the assumptions and sort of the frame of mind people come into class with. And so if you're coming into an online environment going, I hate this, I really prefer face-to-face, your experience could really be altered because of that. So we were pretty interested in not just satisfaction, but preference. And so 3 months later, we asked again, and we had, the face-to-face folks still, not preferring online as much as the online people did. And it stayed consistent about 3 months later. They're still thinking about that experience, and it was still pretty good. And then both groups kind of equaled out here in, face-to-face is a stronger preference for whether they were online or face-to-face in this study. In terms of participant comments, we had a lot of different comments. I'm just going to limit those to the training methodology. And the face-to-face comments appreciated being in person with the trainer and interacting with others. The location was accessible. So, this wasn't geographically isolating or resource poor sort of environments. So things were accessible to the participants. One person worked in the same location, and so they did mention that even though it was face-to-face, they were distracted. You know, the work was going on, people were wanting them to come up to the office and do things. And so they felt like, you know, that they would prefer to go away somewhere and be face-to-face, even though it would cost money and time. And then another comment was that someone who's shyer said, you know, it was difficult to speak up in the group and participating in the activities. This wasn't just limited to one person. I think it was a couple of people. But that is a consideration when you're online. It seems to be a little bit easier for people who might, you know, not want to participate to the degree that this kind of training really does require. And it's easier to sort of be a little bit more anonymous online. With the online comments, the people who were trained online, it was kind of a mixed bag. Some would rather have been face-to-face, others surprised that they really liked the online. They did notice that what their experience was is that people were not talking as much as they would have in a face-to-face. Maybe that, I think they were reflecting on kind of the overall silence that when the facilitator was trying to get interaction, people were less, you know, forthcoming with their participation. They did feel it was accessible and convenient. So implications for this work, I'll talk about the limitations in a second, but implications, online synchronous training really appeared to be as effective as face-to-face. This study was, it's a second study to one that was conducted and that found the same results, that online and online synchronous and face-to-face results were very similar, not statistically different, but they didn't randomize participants. And so we really felt that randomization was an important factor, because if people are picking one or the other, that selection bias can show up in results as well. Opportunities for MI trainers to adapt their training to an online platform and maintain training integrity. So this, you know, and we're seeing this right now with COVID. There's a lot of professional development that has transitioned from face-to-face to online synchronous environments, mostly using, I think, Zoom as the platform. And another implication that is really important is, you know, there's disparities in evidence-based practices and training in those skills and practices for people who are from low resource countries or who are from low resource regions or geographically isolated, as in our rural areas. And so this type of training, being able to offer this training effectively with integrity in an online synchronous platform is really has great implications for the United States, but also for different places in the world. So limitations and direction for future research, the sample size was just one of the difficulties that we faced. We really didn't have enough people in order to say with a lot of confidence that it's the same. The effect size, you know, we would need a much larger sample size in order to really be confident in what we saw in terms of the similarities between the outcomes. We also really felt like additional research was needed, not just to increase the sample size. We would maintain randomization, but to utilize a pre-post series to assess skills. And so part of this is what level of skills did people come in with, and then what level of skills did they have post-training? And that really wasn't our question. So we felt, you know, okay with not testing, not doing audio tapes pre. And it's a big burden on participants. And so that was a consideration that we had as well. But also, what's the sustainability of the skill level? So say 3 months post. What we know about MI is that if people are not getting coaching and feedback and are not practicing and using their skills with some coaching and correction and some feedback, people will lose their skills. They'll go back down to baseline 3 to 4 months after their training. And so there has to be a commitment by the organization and to continue helping their professionals, their clinicians, to maintain the skills. And then another really interesting question would be to test online asynchronous compared to the synchronous and face-to-face. That has not been done. So I have some references, and then thank you for attending. So time for some Q&A. What questions do you have?
Yeah, if you have any questions, feel free to unmute or put your questions in the chat box. I guess I have a question, Mary, if that's okay.
Absolutely.
This is really interesting and obviously very impactful considering what we've just gone through over the past year with COVID and the implications moving forward. I'm wondering, if you know anything about the literature about receiving motivational interviewing online versus face-to-face, if it's more effective is that a thing? Can you receive motivational interviewing, for example, if I wanted to quit smoking or, change some behavior? Is there a difference in the impact of it if it was, synchronously online delivered versus in a face-to-face office setting?
So the short answer is that it is used telephonically or telemedicine, right? Both, in a synchronous in a synchronous, like on the phone as well. And it's used effectively. So tobacco cessation specialists will use it on phone consults or phone check-ins, nurse case managers, medication adherence. So lots of different ways that it's used on the phone. I cannot think of any studies offhand, but I know it's been tested. So short answer is yes, it can be used as effectively.
Thank you.
Yeah.
Other questions? So do you have plans to do another study with a larger group or to expand the study?
I don't have any plans in the near future. I've talked to the person who did the training, and I mean, there's interest, but it would really have to be, this is like pilot data for us, right? It would really have to be funded. We would have to have incentives for participants, and because it's a pretty heavy lift to ask people to audio tape themselves. It's scary for people. There's so much anxiety around that you have to have really motivated participants, number one, and then they have to feel like it's really worth it for them. We had a lot of dropout when people found out actually that they were randomized into the online group. So that's part of the issue too, that people don't necessarily want to do online synchronous or online asynchronous. They really want to be face-to-face, although I think COVID will have shifted that. I think the experiences that we've had with the pandemic.
So that would be interesting because I actually if I had my way, I would prefer online synchronous. So that would be an interesting study to actually select individuals for their preference and place them with their preference of face-to-face versus online synchronous, and to see if there were any differences, if people could choose where they wanted to be. So yeah, I could see how they would be not happy if they were not an online person.
No, and that, Andrea, that's exactly what this other group did. And I'm trying to think, they're out of the University of Massachusetts Medical School. This other group did that, where they allowed people to self-select, which if they wanted to be online synchronous or if they wanted to be face-to-face, and they didn't see any differences. So in the mighty scores. So Steph, I see your hands up.
Yeah, thanks, Mary. And I love the beginning to get us engaged and using some tools that prompted my question, kind of about using what you've learned here about modalities of training with kind of other ways of learning. So I'm wondering if you can extrapolate any of this to what we've lived through, like you just alluded to, and how we can use it to teach in what used to be a traditional classroom. Like Andrea mentioned, she would much rather just be totally online, and then others are terrified of online. So anyway, can you extrapolate anything for what we can learn to help other people just kind of learn using these types of tools?
So helping, for example, faculty or other professionals learn how to effectively use sort of web-based interfaces stuff. Is that what your question is?
Yeah, a little bit. Sorry, I kind of got jumbled there with my words. It seems interesting that, like you said, that it's effective. Motivational interviewing was effective. You could train it across these two different modalities. So what can we learn from that? Or is it just motivational interviewing? Should we not try to take that and compare it to anything else, where we're like other types of training or learning?
Oh, well, and I think, I really do believe that we need to continue measuring outcomes, but I do think that we can use online synchronous more effectively to teach and for people to learn, and not just didactic material, but skills. I think that having had the experience of using Zoom now for my classes, as an example, it's not face-to-face, and there are people who would prefer that. It's not face-to-face, and there are actually people who don't prefer that, right? It kind of levels the playing field in some ways for teaching and for learning. So other evidence-based practices, I think, can be effectively taught through an online synchronous method. The trick for us with motivational interviewing is you can go to a motivational interviewing face-to-face training that is just horrible, boring, people just talking at you, or you can go to a training that's really highly interactive with a really skillful facilitator. And it's the same thing with online. So you can have just a boring class, or you can have active engagement in the class and really use all the tools that we have available to us to keep people engaged. So there's a lot of literature stuff for other evidence-based practices that can be taught online synchronous. Asynchronous, I don't know. I have a little bit of a bias, I think, but.
Thanks, Mary. I asked because there's an undergraduate class that Dr. Youssef and I teach, and students think they want one thing, and then they can't really engage in the way that they need to. And so it's part of my question comes from that place too of, what do you really want, or what can you really handle? And people don't know until they had the experiences right? So part of it's kind of related to that. So thanks for your answer.
Yeah. And there's, there's some evidence actually that online is more burdensome for people in terms of staying focused. So there's a really good PDF that I use in class, in the leadership class, that talks about effective facilitation of groups online. And it mentions that every 5 minutes, we should have something engaging for people to interact with. Every 5 minutes. So there's a big lift for teachers, for instructors, because that takes a lot of effort.
Other questions?
Thank you for attending.
Yeah, thanks so much, Mary. This was so interesting and like incredibly relevant, like ripped from the headlines, and things we can take forward with us, as Steph said, as we're trying to make decisions about coursework and what's good for the students versus what's good for the instructors. So yeah, I mean, it's even going beyond motivational interviewing, and we can take it to other parts of our lives that we're still living in COVID world.
Absolutely. Yeah, a lot of transference, right?
So, well, thank you very much, everybody.